This presentation on hemochromatosis is brought to you by Patricia Romero and Jessica Taylor. Welcome to our presentation, and thank you so much for being here. How is iron used in the body? Iron is introduced to the body through consuming foods that contain iron. Iron is essential in oxygen delivery within the body. Red blood cells transport oxygen through the body and are filled with hemoglobin. This hemoglobin is comprised of heme molecules, which also contain iron in the middle of this molecule. This iron molecule inside of the heme is what oxygen binds to deliver oxygen throughout the rest of the body. The GI tract contains what are called enterocytes, and these cells facilitate the primary site of absorption for iron within the body. Enterocytes move iron through the body as there becomes a need for oxygen binding. What happens when there's too much iron in the body? Hemochromatosis is a metabolic disease where there's too much iron that is absorbed by the body. Iron overload is due to the HFE gene, which affects enterocytes within the digestive system, causing them to no longer appropriately move iron through the body. So, excess iron goes directly to the patient's bloodstream. Iron overload is compounded in patients with hemochromatosis due to the way that iron reacts in the body. Iron causes free radicals through what is called the Fenton reaction, which you can see below, which occurs as iron molecules are oxidized. In this reaction, hydroxyl and hydroxide radicals are created, and since the byproduct of this reaction is hydrogen peroxide and iron, it creates a negative feedback loop of free radicals and iron in the body, which causes damage. The more free iron in the body, the more free radicals are produced, and the more excess iron is stored in the liver and other organs. This excess iron damages DNA and tissues where it is stored, leading to fibrosis, liver cancer, and diabetes, among other issues. What will iron overload look like in our patients? So, from an experiential standpoint, they're going to be saying things like, I've never been so tired in my life, or if I stand up too fast, I feel like I'm going to pass out, or I can't walk as far as I used to without everything hurting or being too tired, or my hair keeps getting thinner and thinner. I hate the way my eyebrows look now. I'm embarrassed to go out in public. Just look at me. My husband thinks I'm lazy and I don't find him attractive anymore. I wish he believed me when I told him how tired I am. So, with this experiential, we can then see what the behavioral patterns will be. Our patients might report things like, I got written up this week for missing work again. I've never missed work before, and I don't understand why I can't wake up now to go to work. I keep missing appointments because my alarm didn't wake me up like they used to. They might also say things like, I used to go for hikes with friends, but now I'm so tired and I'm in pain and I don't like the way that my body looks or feels. They might also report that there's issues with their marriage, such as, I feel like my marriage is at its wit's end. He doesn't respect or believe me when I say that I am so tired and exhausted.
So, some interventions and measurements. How can we help patients with iron overload? Interventions for this population include dietary education, avoid high iron foods, and incorporate foods that help reduce iron levels. High iron foods include organ meats, red meats, some seafood, beans, lentils, and vegetables like Brussels sprouts and spinach. Foods that can help reduce iron levels are eggs, some fish, fresh vegetables, and poultry. Teething drinks have been shown to reduce iron stores by 1/3 in patients with hemochromatosis when consumed alongside meals. This is because tea and caffeine contains taurine, which binds to excess iron.
Polyphenol supplementation, which contains black tea, cocoa powder, and grape juice, which binds to excess iron and allows for the body to excrete it more easily.
We can assess the efficacy of these interventions through blood tests to measure iron levels, questionnaires that focus on patient symptoms, severity, and regularity. Hemochromatosis causes iron overload in the body. This iron leads to systemic damage, which presents physically through weakness, fatigue, joint pain, skin changes, among other symptoms. Extreme fatigue leads to patients reporting changes in their lives, such as sleeping through alarms or missing work. Statements like, I have never been so tired in my life, show that the patient is being impacted by this disease process and that they are not tolerating these changes well. Several therapies can assist the patient with hemochromatosis to minimize symptoms. Dietary education is important. Focus on eating foods low in iron as well as foods that decrease iron, like eggs or tea. These interventions also include patient symptoms logs to assess how they feel on a daily basis. Patients will also benefit from therapeutic phlebotomy and blood testing to assess how well interventions are impacting the patient. Response to illness. Response to illness change based on age because it's uncommon in children and women before menopause. It it's also based on sex because men are typically diagnosed earlier than women. Socioeconomic status because of access to healthcare such as phlebotomy, blood testing, and genetic testing may be impacted by access to healthcare. Ethnicity because hemochromatosis is more common in the Northern European populations, less common in the Asian, Black, Hispanic, and Pacific Islander populations, and in cultural beliefs because foods high in iron may be culturally relevant to patients. Thank you.
Thank you.